on the inside, okay? We know that our injury to a medial collateral ligament is going to be outside direct blow, okay? So when we test it, that's just what we're going to do, is we're going to put a force on the outside of the knee and try and open up that MCL, okay? So if we bend that knee just about 30, maybe a little bit less, okay, then we support the ankle, okay? And then, again, I have bigger hands, so I like to use the palm of my hand. Some people don't have that luxury, okay? And all we're going to do is we're just going to push with this hand inwards, take this bottom hand, and we're just going to try and open it up like that. He shouldn't open at all, okay, because his MCL is intact. If he were to open, it would go whoop and come right on out like that, okay? So they won't open unless they're really lax or they've got a torn MCL right there. Okay, so that's your MCL, medial collateral. And then what we're going to do is we'll do a varus stress test, which is testing the LCL, okay? So when we do varus, we're just going to do the opposite. We're going to be on the outside or the inside of the knee. We're going to, again, support our bottom hand on that ankle, and then we're going to push outwards like that, okay? You want to give a little flexion, all right, because if you have it straight, locked, these get innervated, and then you don't know if they're really moving or not. So you can do it there. You're not going to get much. I like a little bit just to make sure that I'm testing it, to make sure I'm getting that LCL, okay? All right, so that's the varus stress test for the LCL. All right. Going to the ACL test, okay, there are two that I want you to do. The first one is your anterior drawer test. So we're going to bend them, right, to about 90 degrees flexion. Sit on their foot, okay, so you stabilize it. So when you start pulling, it doesn't slide and you get a false positive there, okay. Thumbs go in the joint line. So we're going to find that joint line again. Fingers wrap around the back like this. And just like you're pulling a drawer out towards you, okay? So anterior drawer, just coming right on out that way. Again, he shouldn't slide, because if he were to have torn ACL, he would come right on out. Go, boop, just keep on coming, because there's nothing stopping him from there. That's just going to mimic that tibial slide that we're talking about, that anterior tibial slide that we want right there. So that's going to be your ACL test, anterior drawer ACL test. The other one we're going to do, okay, is going to be a Lockman's test. All right, I'm trying to think what's the best way for me to so everybody can view. We can do it on the side. Okay, Lockman's test. We're going to try and do the same thing, get that slide, that tibial slide, but we're going to do it just a little different. So what we're going to do is we're going to take their leg, we're going to kind of externally rotate the hip, okay, put them about 30 degrees of flexion, okay, right about there, okay. Then we take the femur to support it, and then with our bottom hand, we're just going to slide forward. You should feel a little clunk. Feel that clunk? That's your ACL right there. So I'm clunking his ACL, which tells me it's intact and it's ready to go. If he didn't clunk, it would just slide on out and keep on coming that way. Okay, so that's what we're talking about there. So you get that little slide. Okay, you don't want to do that too much, because then their knee gets sore. So that's your Lockman's test right there. All right, posterior cruciate, only one. Posterior drawer test. So just like we did the anterior drawer, posterior drawer, we're going to do the same thing. Thumbs in the joint line, fingers behind the knee. Instead of pulling towards us, we're now going to push away from us. Okay, so we're going to push towards him. Okay, all right, and that's just that posterior drawer test. Again, you should feel a little clunk if you're doing it. So that's kind of what we're looking there, if you're doing it correctly. Okay. All right, our meniscus. I've got 1, 2, 3. All right, McMurray's compression and distraction test. Okay. So for McMurray's test with the meniscus, all right, it's not our best test that we have. It's just the one that's best for what we can do, okay? So what we do is we take their knee, we put them in 90 degrees, okay? Take your finger, thumb, I like my middle finger, you can use your index finger, whichever you want, find the joint line, okay? Just kind of make that crescent shape right there, all right? What we're going to do is we're going to basically invert and evert his foot, and at the same time we're inverting and everting his foot, we're also going to put pressure, all right, down, all right, and we're looking for a click. All right, clicks and pops, all right, and we're just going to come in and out. All right, we're trying to feel those clicks and pops right there, okay? So in and out like this, and then you can go out and in, all right? So we're just going to move it around, all right? And we're just trying to see if we can't get some. We'll kind of come deep, we'll bring it up shallow, okay? And we're just trying to feel any type of click and pop. The real thing is hand placement here, okay? And then just a little bit of movement here, okay? You don't put too much stress, because you put too much stress, that's going to stress them, and that's not going to feel good for them, okay? All right. The other two for the meniscus, you're going to be on your stomach. Okay?
So when you do that, is like clicks and pops good?
No, it's bad.
Oh.
But it would have to be clicks and pops with pain. Okay? Because if everybody clicks and pops, all right? But if there's no pain, then there's nothing wrong. If it's pain in a click and a pop, then you might have a positive test right there. These two are the best tests for a meniscus, if you ask me, okay? So a compression test. So we're going to put them kind of in that same 90 degree that we had them in, okay? All right, and because we're trying to rub that tibial plateau on that meniscus, because that's what's causing them pain, we're going to try and recreate that. So we take our top hand and we put it on the bottom of their foot, stabilize the femur, okay? And then all we're going to do is put some pressure, and we're just going to grind that tibial plateau into those meniscus. If we think it's a medial meniscal tear, we'll be on the inside, okay? If it's a lateral meniscal tear, we'll be on the outside. And we're going to grind it. We're just going to grind and see. And they'll go, ow, that hurts, that hurts. I'm like, okay, well then let's try this. If that hurts, then we'll do a distraction test. All right, we'll take the same thing, we'll just flip our hand over and we'll pull that tibial plateau away. And we'll say, how does it feel now? I'm like, God, it feels so much better. Then you know you've got probably a positive test for a meniscal tear right there because you pulled that tibial plateau off of the torn meniscus, okay? So that's it. So you got McMurray's, compression, and distraction on that one. And the last ones are patella, right? Yep, last ones are patella tests, okay? Patella test, I told you that one where I said you can make them jump off the table if they really have a patellofemoral issue, okay? All right, so the first one we're going to do is just called apprehension test. And basically this is for a subluxing patella or a patella that has dislocated, usually laterally. We just tell them to relax, then we're going to take it and we're just going to move it sideways like that, okay? All right, we're looking for a clunk, all right? If it doesn't clunk or if they don't jump off the table because they don't want you to do it, then you know that you don't have it. You won't have a dislocated patella. But usually that'll cause a lot of pain just by sliding that patella sideways like that, okay? So that is that one. The patella compression test is basically we're going to push down on the patella. So we're just pushing down into the femoral groove, okay? We're compressing that back side of the patella down to try and see if there's any type of chondromalacia or something like that underneath there, okay? All right, so that's the compression test, just pushing down on it. Makes sense on that one. And the last one is the patella grind test. This is my favorite one, okay? So what you do, take the web of your thumb and your index finger, and you're gonna push down on their patella, okay? All right, usually everybody has a little chondromalacia, all right? So you can actually get the grind. You should all be able to feel a little grind. You feel that little grind right there? Now, if you really wanna get them, is you tell them to contract their quad while you have them in this position right here, and it hurts.
I don't think I would.
Don't do it, okay? But I'm just telling you, you can do that right there. It hurts a lot. And you're like, what did you do? Like, what are we talking about? So that's just it. But the grind test is you're grinding that patella into the femoral groove and that little roughening under there, okay? Everybody should have a little grind right there. And then manual muscle tests, just so you remember, when we're testing flexion and extension, okay, you want them sitting like they normally would sit, okay? So, nice, okay? If we're gonna manually muscle test flexion, okay? All right, all we're gonna do is resistively do this. Now remember, you want them to do it active first, which means they do it first by themselves. Then you can do passive, which is you do it for them, okay? And then if you're gonna resist them, you just support here and say kick, okay? And that's just a resistive test, all right? If you wanna resist extension, same thing. You get them to this position, you hold them here, and you say, all right, pull. And that's a resistive test right there, okay? So that's really the only two that we're gonna do for the knee is flexion extension when we do those, okay? You don't have to do it that way. You could actually just have them stand up and do a squat. And that's a good way to just do another type of resistive test right there because now you're using the floor as the resistive mechanism too. So you don't have to. I just like to do that really quick just to test it for some strength if we have an issue. Done.